Plantar heel pain. Don't you mean plantar fasciitis? I mean, everyone knows that plantar fasciitis is a tensile traction injury caused by pes planus and excessive pronation, don't they? Whoa, that can of pigeons must be really flapping about now. Talk about put my foot in it. G'day, I'm Ted Jedinake, international educator and health practitioner with over 30 years of clinical experience treating MSK conditions of the lower limb. I help foot fixers, podiatrists, physios, chiros, osteopaths and other physical therapists take their skills and expertise to the next level so they can get the clinical breakthroughs their plantar heel pain patients expect. It's all about shortcutting your path through the conflicting research, complex issues and the unpredictability that surrounds plantar heel pain. By giving you battle-tested answers, I'll save you time, energy, and your hard-earned money. So if you're interested in doing more than just prescribe orthotics for your plantar heel pain patients, then welcome, this blog's for you. This is the second plantar heel pain blog in a series of 8 that are exclusively designed to take you step by step through the quagmire that surrounds this tricky condition. By the end of this blog, you'll be one crucial step closer to more predictable plantar heel pain results, I promise. In fact, you'll be able to accurately cite the primary anatomical structure that's affected in mechanical tissue stress plantar heel pains. And it's not the plantar fascia, and it's not the calcaneal spur. Now, my introductory questions were meant to be provocative, but you know what? It wasn't that long ago when I genuinely believed that plantar fasciitis was the pulling off of the plantar fascia that caused heel spurs to grow. In my last blog, I chatted about how root theory was the holy grail of biomechanics when I graduated from university, and how on weekends I made my own orthotics in a makeshift lab that was at the back shed of my clinic. Now, technology has changed all of that, probably for the better. But you know, I kind of miss that man cave. Since then, I've spent a lot of time, energy, and money trying to find the answers to a heap of headaches that plantar heel pains were giving me and my patients. I'd pick up the best bits and pieces and, from conferences or other CPD events, but it was a long, circuitous path. Now I've done the hard yards so you don't have to. Thanks for watching this video and for your interest in getting more predictable outcomes for your plantar heel pain patients. It's vital that we foot fixers step up to the plate and get a firmer foothold on the assessing, treating and diagnosing of plantar heel pains. It's the #1 MSK condition of the lower limb and the #1 source of biomechanical frustrations for us foot fixers. In today's blog, I'll explore the latest thinking to what anatomical structure is the primary cause of plantar heel pains. Hopefully I won't put my foot in it again. Hey, look, getting clear on the biomechanics is crucial. It's fundamental, right? I know this information really changed the way I thought about plantar heel pains and how I subsequently went about treating it. First of all, we're going to rule out the term plantar fasciitis. As you probably know, the plantar fascia, it's almost completely avascular. There's no histological evidence to support the notion of the plantar fascia getting inflamed. So, given that plantar fasciitis is not primarily inflammatory in nature, it should therefore be regarded as fasciopathy with a nomenclature of plantar heel pain. Last year, the British journal Sports Medicine published an editorial piece titled, "Is plantar heel pain a more appropriate term than plantar fasciitis? Time to move on." Good to see this editorial published in such a respected journal, but way back in 2003, good friend and podiatric nemesis Simon Bartold published his article, "The Plantar Fascia as a Source of Pain, Biomechanics, Presentation and Treatment." In this article, Simon clearly states the need to move on from plantar fasciitis to plantar heel pain syndrome. How slowly the wheels have turned to get clarity on this condition. Okay, now back to the promise of today's blog, which is clarity on the actual anatomical structure that is directly involved most commonly in plantar heel pains. And that is, the evidence tells us that it's the enthesis that causes our patients grief. Now, enthesis is defined as the connective tissue between tendon or ligament and bone. You can see here exactly the enthesis of the plantar fascia and where it's located. This paper by Waring et al., The Pathomechanics of Plantar Fasciitis, is one of the best evidence-based sources describing the histology of plantar heel pains. Even though the paper is titled The Pathomechanics of Plantar Fasciitis, it describes the changes in thinking in plantar heel pain pathomechanics. In particular, it addresses the anecdotal causal link of pes planus foot types and lower limb biomechanics, resulting in lowered medial longitudinal arch. This histological thinking has been thought it was created excessive tensile strain in the plantar fascia, leading to microscopic tears and chronic inflammation. Now, the current science tells us several elements that are worth knowing. It supports the role of arch mechanics with the plantar fascial stresses, but the evidence is somewhat ambiguous because there's difficulty in measuring arch mechanics in vivo. Now there's also the affected anatomy. The connecting element of the plantar fascia to the calcaneus, the enthesis, is brittle and therefore susceptible, especially with aging. And third, etiological physics. Bending, shear and compression forces are probably more important than tensile loads. The current thinking also tells us that changes in plantar fascia thickness are of greater importance. It's been reported that more than 4 millimeters of thickening of the plantar fascia enthesis, the part that attaches into the bone, is abnormal. The plantar fascia thickness is readily measured by ultrasound. So there you have it, the science-based evidence telling us that the enthesis is the primary anatomical structure that's affected in mechanical tissue stress plantar heel pains. We can confidently throw out the term plantar fasciitis and the corresponding explanation of it being a tensile traction injury caused by excessive pronation. With a new understanding of biomechanics and plantar heel pains, we can focus our treatment on addressing the etiological physics of bending, shear and compression forces for better clinical outcomes. We'll be addressing those in an upcoming blog. You won't want to miss it. In next week's blog, you'll discover how to effectively differentiate the 47 conditions that can cause plantar heel pains. In the meantime, do yourself a big favour and download the reference links I've referred to in this blog and read through Scott Waring's paper. It's worth its weight in gold, which at the time of this recording is increasing in price quite nicely. Thank you very much. You'll find the links to these articles down below. You'll be a crucial step closer to getting even better clinical results for your plantar heel pain patients. I can't tell you how much I wish I'd known this stuff much earlier in my career. It would have saved me a heap of headaches. Thanks for watching this video, and thank you for your interest in getting more predictable outcomes for plantar heel pains. It's truly inspiring to be with health practitioners who make it their mission to get the breakthroughs that help more people like never before. Join me next week for more battle-tested plantar heel pain shortcuts. Ciao.